So I want to review how to perform a squat as an exercise and to really manage pressure within the system. So we always want to manage our intra-abdominal pressure. Now the thing about pressure is that it's normal, and we have intracranial pressure, we have pressure all over the body, right? And that's normal, right? But we need to be able to manage it well to avoid doming or coning of the abdominals, to avoid excessive pressure downward in the pelvic floor, to avoid back pain, things of that nature. So I want to go over how to perform some coordinated breathing. So we're going to inhale, and then on an exhale, I want you to think about drawing in your two pointy hip bones together and gently bringing the pubic bone up towards the ceiling. Okay, so it's really different in a sitting position or a standing position, bracing, compared to lying down or in quadruped. So I like to try it in different positions, because if we get really good at bracing lying down, well, that's only going to help us when we're lying down, transitioning from lying down to sitting up, or if we're doing lying down exercises. But we really need to be able to carry this over into more functional based movements as well. So again, we're going to take a good deep inhale, exhale, try to draw belly up and in. Okay, and at this point I feel appropriately braced. I'm going to inhale again, exhale, and stand up. Inhale down, exhale, stand up. Now what you can practice is taking some weight. This is 13 pounds. So something that is appropriate for you, whatever feels right. You want it to be challenging, but not too heavy. And certainly if you're noticing any sort of pain, we would want to decrease load. If you're noticing coning, doming of the abdominals, we want to look at, okay, are we bracing appropriately? If yes, then the weight is a little bit too much, so we want to decrease that load as well. If we're having pelvic heaviness, incontinence with the weight that we're choosing, then we want to go lower on that weight. So now we'll practice the same exact thing. We'll inhale. I'm going to exhale, brace my core. Inhale again. Exhale. So I like to practice this. This should be practiced and incorporated into your daily life. So again, lifting the laundry basket, getting up and down from a chair, whatever it might be, that kind of coordinated breathing pattern. We also love to talk about tension to task. So if we're lifting something very light, we might only need to brace very minimally. If I go to pick up not 13 pounds, but say 53 pounds, then I might have to brace my core a little bit more. So keep that in mind as you are lifting, as you are picking up children, as you are doing household chores, that we don't need to brace 100% when we're doing a very small or minimal task. But as that load or demand gets higher, then we might need to engage more of the abdominals and a bit of the pelvic floor as well.